Okay. Hi everyone, this is Kayla. I'm just going to get started. Thank you so much for attending the weekly calls. Today is just going to be brief updates, and then we're going to have more of an in-depth training Jacob's going to do over REDCap, just there's been a lot of questions, and just to make sure everyone's on the same page before the trial starts. So I'm actually going to record today's call to post it on YouTube too. It's just a secondary training for REDCap as a reference, just so you know. Quick roll call. I see that Jacob is on from Indiana University. Is Janetta on?
Yep, we're all here.
Oh,
yep.
Hi, Janetta.
Okay. And Ronnie.
Okay.
We're here.
Yep.
And then Savannah is on. Amy and Peter from UMass.
We are.
Hello. And Rabathi from Cleveland Clinic. Is Zanette on the call?
Coordinator.
Okay. All right. Is she joining the call, Rabathi? No. No. Okay. And then Jennifer and Savannah from IU are on. Amy from Mayo's on. Kevin and Janelle, are you on?
Yes, I am.
Okay.
No, Kevin.
And Janelle?
Yes.
Oh, hello. Sorry.
Oh, hello. I'm sorry. Rafi and Annette are both here.
Okay. Thank you for clarifying.
Yeah, of course. Sorry.
No, it's okay. BCU, Stephanie and Rebecca, are you on?
We're both here.
Okay. Hello.
Hi.
University of Massachusetts, Lisa.
Yep, Lisa's here.
Hi, I'm here.
And Donna.
Donna's not here.
All right. And Monique and Mary.
I'm here.
Welcome. And then University of Louisville. I saw Amar's on, Pranette and Shanaka. Sorry if I pronounced it wrong.
Yeah, we are on. Yeah.
Okay, great. Thank you. And Carol from Pittsburgh, are you on? No? Okay. And then Samantha, I know you're on from UT Southwestern. I saw your name.
Yeah, I'm here. Hi.
Hi. Okay. All right. Thank you so much. And we're just going to go through really quick updates. The observational trial, the approval is still pending. Hopefully we'll know soon. They had just minor modifications to the consent, which were approved by RPI. We just need WERB to send us the documents. So hopefully this week or next week that will happen. And then I will send out an email to everyone, including the PIs, that it's been approved. And I have a kind of a list of next steps to do. And Chris Ganai from WERB, he'll be a great resource too if you don't remember how to submit in WERB, and you can contact me as well. Or you can do that through training, but there'll be a next steps within the email to guide you. And if you have questions and stuff, please contact me. I'm always here for you. The clinical trial, I have sent to all. If you're not, Mary, if you don't mind, here, I think I can mute you. Mary's making noise. Okay. The clinical trial, right now, the PIs are reviewing the protocol. This weekend, Dr. Gower and I will go through their suggestions and modify the protocol, and I will send to you all the coordinators for review this coming week, and that is for the clinical trial. Updates. Amy, do you have updates on the biorepository?
No major updates, just I sent out the most recent version of the MOP either yesterday or the day before to everyone, so you all should have gotten that. That has the most updated lab supply list for ordering your supplies. Peter has been actively working on aliquot labels, which we are still aiming to send out to everyone prior to enrollment beginning for the observational study. We did have a call with the translational PIs yesterday afternoon, and there was still some clarification needed, unfortunately, on some of the samples that were collected and or that will be collected. So we're amending the label template that Peter had worked on earlier this week. We thought we had it finalized, but we do have to make a few additional changes. So we're hoping to start sending labels out within the next couple of weeks to everyone. Other than that, no major updates. We do have our freezers ordered. Those should be on the way. if anyone has any other specific questions for me, either on the MOP or other biorepository issues, you can certainly email me and I can respond to you separately. I think that's it.
Thank you, Amy. Do you have an update on the website by chance? I know.
Sure. Yeah. So we have a few coordinators still working on description for potential patients to read for the website. We're hoping to get that implemented by the end of the week. I've also received, or I sent the website to the steering committee for their review. I guess I should say not this whole steering committee, just the subcommittee chairs I sent it to. So PIs are looking it over, as well as Svetlana, and I've asked them to give us feedback by the end of the week. And so once we receive that feedback, I think we should be ready to roll. So hoping to get it live maybe as early as next week.
Oh, that's awesome. I'm really excited about that.
Yeah, we are too. It looks really great.
Yeah, I was playing around with it because I saw the link, and it's really amazing. So is his name Josh that's been working on it?
Yes.
Yeah, he's doing an excellent job.
Yeah. Well, thank you. We agree.
yeah, no, he seems great. So do you have any other updates or anything you want to add?
No, that was it.
Okay. Savannah, have I covered everything?
I think so. I just wanted to add all the coordinators remember to please send me CVs of every sub-investigator and every coordinator. I need the CVs. I need medical license if applicable. I also need city training, which is the GCP, not just any city training. And send me the CLIA, the CAP, normal ranges, things like that. Just a reminder, if you haven't yet, please send me those soon.
Yes, thank you, Savannah, for the reminder. Does anyone else have any concerns or questions about anything that was discussed, the lab manual, biorepository, the trials? No? Okay. Well, if you do, please contact us. We're more than willing to help. Moving on, has there been any staff changes to any of the sites? Has anyone left or joined this consortium? No? Okay. Well, thank you.
Actually, Kayla, sorry to interrupt you. This is Amy.
Yes.
I did just want to mention that Candice Dufour, who is Dr. Zabo's project research coordinator, I'm not sure what her exact title is, but she's going to be helping me out with some of the administrative side of the translational and biorepository, just some of those administrative tasks. So if any of you see emails coming from Candice Dufour, she is helping us here at the UMass DCC.
And I usually include her in all the emails with the PIs too. Just so you know. So she's been
That's great.
Yeah, from the beginning. So moving on, Jacob is going to present and have another training on REDCap. So
okay. So I was going to do a split screen for everybody, but for some reason the computer that I'm on is too small and it's presenting some weird issues with REDCap. So I'm not going to do that. So please pull up the PDF that I have on screen now. The subject ID is 91035, and then there's another one that's 91036. Just so you can follow along. I'll try to read off the questions as best as I can to give you, indication of where I'm at. But just, it'd be easiest if you could see what I'm doing as I'm doing it. Okay. And everybody can see the screen, okay?
Yes, it looks good.
Cool. Okay. I'm going to switch over to REDCap. Okay, so what I'm going to do is I'm going to enter a subject from start to finish with a baseline. So we'll include the screening and the baseline visit information. And then I'm going to kind of point out the areas that some people had some questions on, and some of the areas that kind of confused a couple people as well. And then I'll point out some changes that I've made to the actual database itself based on your feedback. So I'm going to use the actual production versions today. Okay. So starting with the enrollment and the screening, we're going to go into AlcHepNet screening and click there. Okay. Once we are in the project itself, we're going to click Add Edit Records. And we're going to go to this text box right here, and then we're going to enter their record ID, which is 91035, and then hit enter. Okay, once you do that, this screening form will pop up. The date of the screening visit is at the top of the form. I really recommend that everybody fills out every single header on top of every page. I know it might be a pain, but if you were to ever drop the forms and they would scatter everywhere, this would be a good way to put them back together quickly and easily. Okay, so the date of this screening visit is January 19th, 2019. Type that in. You can also, if you'd like, click on the calendar, but I think it's quicker if you type in the date. Okay, I'm going to put in the participant initials. A couple people put in their initials, like their personal initials here. That's probably due to the directions on the, the training subjects. But I do want to be clear that any field that asks for initials is for participant initials only. And there are spots, as you can see at the top of each form, for those initials, as well as on the cover sheet for the baseline visit. Okay, so these initials are PKN. Okay, they're being enrolled for the observational study, so we're going to check that off. Once the clinical trial starts up, you can click here as well, but right now this won't get you anywhere. And if you do click it, we will probably undo it for you until the clinical trial starts. Okay. So observational study informed consent signed. Yes. Okay. And if at any point as I'm going and you have any questions, please stop me and ask. I'm just going to continue on if you don't. So this person was enrolled in the observational study and their consent date was the same day as enrollment. So that's 1/19/2019. Okay. They are an alcoholic hepatitis case. Okay. And doing all of that will populate the appropriate inclusion-exclusion criteria. Okay. And if you don't answer those questions, this one in particular, the subject arm, you will not see the correct inclusion-exclusion criteria. Okay. So the subject does have a clinical diagnosis of alcoholic hepatitis. So say yes. Their total bilirubin is greater than 3. Say yes. Okay, and that bilirubin was 3.2. Okay, and it was collected the same day as the visit. Okay. The subject or guardian has the ability to understand and willingness to provide written consent. Yes. And they are older than 21. Yes. Okay. For exclusion criteria, they do not have a liver disease significantly caused by the following. So we're going to say no. And they are not pregnant or breastfeeding. So having answered all those questions, all the inclusion, exclusion, yes, or the inclusion yes, and all the exclusion no, they are eligible to participate in the study. So we'll say yes. Okay, and then they were enrolled. We'll say yes. And then they were enrolled on the day of the visit. Put that data in there. Okay, and that's all there is to it. Pretty much everyone did a great job with this form. It's pretty straightforward. There aren't any tricks, but I did want to go through it one more time just to reiterate everything. Okay, does anybody have any questions on the screening? No? Alrighty, so yeah, when you're finished entering all the data, make sure you mark it as complete, save and exit, and then you're done with this database. Okay, so next we're going to navigate back to My Projects. And then we're going to go to AlcHepNet. And again, this is the database that holds everything. And actually, I'm going to go back really quick. For those of you who are unfamiliar with REDCap, I have all of my projects in folders, and you can do that by going here. If anybody wants to organize theirs into folders, you're more than welcome to. I can help you if you get confused, but just as an aside. Okay. So you can, yeah, it's easy to see which projects go with which study if you do it that way. We're going to go into AlcHepNet. Okay, From here, to add a new record, we're going to go to Add Edit Records. And we're going to make sure that this drop-down menu right here says ARM1, Subject Profile. It's the second drop-down menu in the second row drop-down menu. We're going to go into this text box that's right below it, and we're going to type in their record ID, or subject ID, which is 91035. We're going to hit Enter. Okay, and then it's going to pop up all of the subject profile information for this participant. Okay. So we're going to go into the enrollment information. This participant's initials are again PKN, and we're asking you to enter these multiple times so we can align the records because they are held in two separate databases if we do need to align screening with the actual AlcHepNet database. Just need to check for us. And they're enrolled in the observational study, so click observational. They are an alcoholic hepatitis case, and they were enrolled on the 19th of January. Okay. And that's all there is to this form. You'll click complete, save and exit, and you're done with enrollment information. Okay. So moving on to the subject profile, I'm going to click on the bubble right here. Okay, and it'll pop up the subject profile. The visit date, again, was the 19th of January. I'm going to type that in. Okay. Their birth date is October 18th, 1974. Okay. They're male. Their ethnicity is non-Hispanic. Their race is white. They're divorced. They do not have any children. Okay. And one of the questions I did receive was about the branching logic and how the skip logic works in REDCap. So if you do not need to see a question as it's answered on the paper forms, you will not see it in REDCap. So like for question 6, I believe, question 5, since they're not married, you do not see the "is your spouse living at home with you" question. And that's just to prevent you from accidentally entering something that shouldn't be entered. Okay. So for question 7, they have completed trade school and some college. Question 8, are you currently employed? Yes. Okay. Moving on to the medical and surgical history. Question 9, are they hospitalized at the time of enrollment? Yes, that pops up the admission date field. So we're going to specify the admission date here, which is the 10th of January. Admission date. Okay. Here, their height is 175.6 centimeters. Okay. They have not had any type of bariatric surgery, so no. Were they hospitalized in the last year due to alcoholic hepatitis? Yes, that pops up. Question prompting for how many times they were hospitalized for alcoholic hepatitis, and they were hospitalized 3 times. 3. Okay. What age did they begin drinking? They began drinking at 17 years old. Okay, the date of their last drink was actually the day that they were enrolled. So we're going to put that date in here. Okay. The typical daily intake of alcohol, so the number of standard drinks that they have is usually 5, which is, if you do the calculation, 5 times 14, I believe, is 70. So we'll put 70 grams of alcohol. Okay. And they drink on average, or for like the time that they've consumed that amount, is 4 years and 7 months, which is 55 months. So if you want to do it in months, you can put 55. Click months as the unit for that. Question 16B. Okay. So number of admissions to alcohol treatment programs is 4. There. Okay. Are you currently using intravenous drugs? No. Okay. Has your blood or natural father been an alcoholic or problem drinker at any time in his life? This person did not know. And then, has your blood or natural mother been an alcoholic or problem drinker at any time in her life? No. Again, if you were to answer yes, this would populate more questions, but you answered no, so you will not see them. Okay. And so 21, do you have foster or adoptive parents? And this person does not. Okay. And that is it for the subject profile. Does anybody have any questions about this before I move on? Again, nothing tricky, super straightforward. Okay. So I'm going to mark it as complete, and then I'm going to click Save and Exit. Okay, now I'm going to move on to the ConMeds. And this was a spot that kind of tripped some people up because they weren't used to the repeating forms, so I'm going to kind of go over those with you here. Since it is a relatively new addition to REDCap. So I'm going to click the bubble. I did get a question about these text fields right here. Because they are connected to an online dictionary of sorts of terms, they're slightly grayed out, and I can't do anything about that. I'm sorry. I've talked to the people at REDCap, and I think they're looking into it. But do know that this isn't a read-only field. You can actually click in and type. So this first medication is LASIK. So I'm going to type in LASIK. Click the first option. Okay. We're taking 40 milligrams, so 40. I did get a suggestion, I think it was from Kevin from Mayo, who wanted me to put in the abbreviation. So you can click in here, and you can now type, like if it's milligrams, you can type mg, and milligrams will pop up. But if you don't want to type in mg for whatever reason, you can still type in milligrams, and it should pop that up as well. So you've got some options. So thank you, Kevin. Appreciate it. That was a good suggestion. So frequency, same deal. Okay, they're taking it once daily, so you can click that. Route of administration is oral, so it's a PO. Click that. Okay, the indication for this is ascites. I'm going to type that in, wait for it to pop it up. Click ascites. Okay, they started the medication on July 19th of 2009. I'm going to put that in there, and it is ongoing. Okay, so that's it for that medication. So I'm going to click complete. And now, since you do have more medications to enter, you do not have to go out of this form back to the record homepage. You can if you want to, but if you want to add a new instance directly from this record, you can click this little drop-down menu up here and then save and then save and add new instance. Okay, and then once you do that enough, it will actually become the default option up here. But since we haven't used this for top enough, it is not yet for me. Okay. I'm going to put in the next medication, which is lisinopril. Type in lisinopril. First one.
Hey, Jacob.
Yeah.
Hi, this is Lisa at UMass. I just had a question on the medication. Can you go back to the drop-off box?
So this down here, the one up here?
next to lisinopril.
Oh, here.
So when you click that, there's a whole bunch of options. Are we just going for the basic lisinopril?
If it's there, yeah, that's what I would choose first. But if you want, you can choose the specific one too.
Okay.
Really, we did this to avoid misspellings and to give you an easier way to select the appropriate medication.
Okay, great, thanks.
So I'm going to choose lisinopril. But yeah, if you do, actually, if you chose that, for instance, all the information that's up here is asked down here, we'd still like you to fill out all of this information. Because this is just like a digit, and we won't necessarily know that it's 40 milligrams oral tablet from this number until we do some digging. So please make sure to fill out all of these as well. G. Okay, do it once daily. And this is oral as well. So we type in PO, select oral. The indication is hypertension. Type that in. And they started this on November 23rd, 2017. Okay, and it is ongoing as well. So once you finish with that, make sure you mark it as complete. And if you don't have any more medications to enter, you can click Save and Exit. And this, for a baseline, these are all the forms you should fill out. If a person is pregnant at baseline, they're not eligible for the study, so you don't need to visit this form. And if they've passed away, very shortly after baseline, then you would have to fill out this form, but otherwise you do not have to visit these two forms unless you have information to fill out, and that was a point of confusion for some individuals. So I did want to point that out. As well as this, so if you do go into the pregnancy notification form, if you remember this person is a male, before you were able to fill this out even if they were a male. So now this notice pops up. So it asks you to double check just to make sure that this is, was entered correctly or this is the right participant. And if it is the correct participant and it was correctly entered as male, but they're still pregnant, just let us know and we can open up the form for them. Okay. None of that. Okay, so from here, here's the quirk to this REDCap. To continue entering information for this individual, you'll have to go back to Add Edit Records. Okay, you'll have to go back to this drop-down again. You will select the correct arm for the study and for whether or not they're a case or a heavy drinker. So in this individual should be entered under odds age cases. So arm 2, click that. Okay, and then we're going to enter their record ID one more time. And then we're going to hit enter. And this will bring up all of the visit-related, study-related forms that you should fill out, or that you'll need to fill out. And we did this primarily because of the clinical trial. And once that starts up, you'll see a 5th arm for the alcoholic hepatitis clinical trial folks. And so when you register one person, you use the same ID. If they're already registered under the observational study, you'll use their same ID, register them under the clinical trial arm, and that means you won't have to go back to that subject profile, and you won't have to re-enter all of that information. So that was the major point of doing it this way. So this is, really the only step that you need to super pay attention to, because it will be important later on. But we will come back to it once the clinical trial starts up as well, just to reiterate everything. Yeah. Does anybody have any questions about that? I know a couple people got stuck on it, but I tried to walk you through it as best as I could. All righty. So we're going to go into the visit form. Okay. So for baseline, they should be in for an in-person visit at baseline, so you shouldn't see a question about, missed visit. So their visit took place on the 19th of January, so we're going to put that in here. Okay. This person does have some of their visit medical information completed and filled out, so we're going to click yes. That brings up the medical information form. Since the method of data collection is paper to be entered in REDCap, we are going to select this first option here. If you're doing direct entry without the paper form, you would select this, and that would pop up some signature fields. I can show you. So you would have to, add the date that this was entered, as well as add a signature, and you can do that here. Okay. And that's just to maintain source document compliance. And so we will be checking very thoroughly for that. Okay. So for question 1, they do have ascites, so click yes. The date of last diagnosis was the 20th of December 2018. Okay. They do not have
Hi,
spontaneous.
Jacob. This is Nick at
Yeah,
UMass.
sure.
Can I interrupt you for a moment?
Sure.
Well, before you go on, we've run into this in the past, that we can't necessarily in their medical record find the date of diagnosis.
Okay. In that
Appears
case,
in the notes, and I know this is a must-have value. Is there another option we can use? Because we've run into this before with U01.
Do you have the year of diagnosis or the month and the year, even if it's not an exact date?
Not necessarily, unfortunately.
You should give me calendar of the.
If we can have a convention for unknown, but at least the year would be good to know. Then we use the middle of the year for.
We'll touch base again with you. We might modify this a little bit to accommodate that. Thanks for bringing that up.
This is Jennifer. I'm just going to say I totally agree with her. There's oftentimes things like this it's really hard to find without just kind of making it up and a guess.
Yeah, we don't want you to do that.
Right, exactly. So she's correct sometimes.
Is it just for the physical exam, Jennifer?
No, when you ask for a specific date of diagnosis for anything, sometimes if it hasn't been properly recorded in an EMR that you have and the patient is encephalopathic, I mean, they may be able to tell you that, yes, they've had fluid removed from their belly, but they don't remember when it was. And in those cases, like in my source documents, I will put, patient reported, but, she is correct that it's often not possible to even give a year because of the patient self-reporting. So, or it's not correctly recorded in the EMR, just that they have a history of it.
Okay.
Hi, this is Savannah. I think that's going to happen with medication too. Sometimes you ask how long they've been taking something, and they're like, I don't know. So,
yes.
It would be good to have like unknown, or at least do like 0000 2017. So sometime in 2017.
Yeah.
Okay, well, we'll come up with some instructions on how to deal with these unknown dates.
Thanks for bringing that up. Okay, so moving on to question 2. They do not have encephalopathy. No. Were any varices present, moderate or large? Yes. At any time, so click that. And again, here's the date. For all of these values, and have you had any of the following? Do ask for dates. So we'll have to get back to you on that. This person was last diagnosed on June 13th of 2017. Okay. They have not had liver cancer, so I'm going to say no, and they have not had a liver transplant, so no. Okay. A liver biopsy history. The patient has had a biopsy within the past 2 years. We're going to open that up. Of this date field, they had it on the 4th of March, 2018, 3/18, 2018. Type that in there. Okay, and they had it on site. Okay. Moving down to the specific medications. These are all yes, no. They're pretty straightforward. There aren't any tricks to these, so I'm going to kind of go through them a little faster. So they were on Lasix, so yes, diuretic, no lactulose, no antibiotic, no steroids, no, or how we say that? No, no, no. Okay. Okay. Do they have any anthropometric measures done? Yes. Okay. And here you can enter all those. So their waist circumference is 102.1. They're at the largest diameter. Waist circumference is again 102.1. And this person might be not proportional. I didn't set it up so they would be proportional, so ignore it if these look weird. Hip circumference is 95.7. Wrist circumference is 18.6. Forearm circumference is 34.0. Okay, so use the left arm. The mid-upper arm circumference is 40.6. And again, they use the left arm. Okay, so we move on to the liver disease scoring. They did have information collected on liver disease scoring, so we're going to open that up. This is a paper to CRF, or paper to REDCap, so we click that. Again, date of the liver disease scoring was the date of the visit. So 1/19/19. Their MELD score is 27. Okay, and the Child-Pugh score is 13. There's something I did want to point out on the paper CRF itself. If you notice, the table for calculating Child-Pugh score does have an instruction now to please circle the items that led you to that score. And that's something we'll use when we audit, just to verify that your selections match up with the score that you entered. And then we'll also do some checks with the other data to make sure it all lines up. So if you could please do that, that'd be wonderful. Okay. The patient has not had dialysis twice in the past week, so no. Okay. Moving on to vital signs. They do have some vital signs, and again, it's in the paper to REDCap. Okay. So body weight, they're 134.6 kilograms. Okay, BMI, their BMI was calculated to be 43.7. And this, I did leave this off intentionally in the training subjects to see if you guys would calculate it yourselves. And that's what we would like you to do, since they do have height in the subject profile and they do have weight here. You can calculate it using the NIH's BMI calculator, which is linked in the MOP. It's a pretty handy tool. I have it bookmarked on my web browser. Okay. Temperature, 36.9 Celsius. Okay. Systolic blood pressure is 134. And their diastolic blood pressure is 87. Okay. Pulse is 46. Again, this person has a very low resting heart rate. Respiration is 18. Okay. Standard of care procedures, they do have some standard of care information that you would need to enter. So select yes, and then you'll be asked the different categories of standard of care procedures to see if those were collected. So infection screen, yes, they do have some infection screen information that you need to enter, so click yes. Blood culture was done, but it was negative. The urine culture was not done. So click that, and then again, it collapses the urine field, so you don't need to worry about them. Okay, and then the ascites culture was done, but it was negative as well. Okay. They did not have any X-ray information that you could find or any that was completed, so you're going to select no. Did someone have a question? Okay. Okay, endoscopy? Yes. Okay. So varices, are varices present for question 5? So they did have gastric varices. So we'll click gastric. Those gastric varices were small, and there were no signs of recent bleeding. Okay. Moving on, question 6. There was no portal Hypertensive gastropathy present, so we're going to click none. Okay. And then for ulcer or erosions present, this endoscopy did not find any, so we're going to click none here. And this is one of those fields that if you were to click like stomach, for instance, and then try to click none, it will tell you that that's not possible. So if you encounter this, you can either clear the selections that are not none present, or you can click cancel to keep them. But this is just to check to make sure if you do click none, you can't say that they actually had none and esophageal present at the same time. Okay. Was the FibroScan done? No, FibroScan was not done. So you can click that. Okay, so physical exam. They do have some physical exam info. This is a paper to REDCap entry, so you can click that. Was it collected from the medical records? This person physical was not. That's something that you'll get just from either doing it yourself or looking in the medical records. So it's not on the paper form itself. The date of the physical exam, I think I put it as 1/1. I don't know why I put it as 1/1. I meant to put it as 1/19. So it was 1/19/19, and that is on the second page. Oh, this is in day-month format. I'll fix that before it goes live. So you can do month per year. Okay. So their general appearance, they're in the hospital, so they're ill. So I just selected abnormal and then said they're ill. They're very ill. And other than that, they're pretty much fine looking. So their skin is normal. Their head, the head and neck area is normal. They did have some enlarged cervical lymph nodes. We're going to click abnormal. Abbreviate lymph nodes. Okay. And then their chest was normal. Their heart was normal. Their abdomen is distended, so we're going to put abnormal and then type in distended. Then for question 8A, they did not have any hepatosplenomegaly. They did have ascites that were grade 3, apparently. Okay. And extremities are normal, so we're going to click normal. Nervous system is normal. And then other was not done. Okay. And that wraps up the physical exam form. Does anybody have any questions on that form specifically? This one has a little bit more skip logic to it than others. Alrighty. I did fill out the questionnaires, but I'm not going to enter them here because it's quite a bit of data entry and we don't have much time. But I do want to point out that that on the CLDQ, some people didn't see that the last option on the right over here is not done, and it is not, that column is not included on the paper form because of the patient-facing nature of the questionnaires. So if the patient forgets to fill something out or refuses to enter a value for whatever question, this is where you would mark that. So just please be aware that if you're trying to enter none of the times 7, it goes into the second from the last. It does not go in the last column. A couple people got that wrong, but that's okay. Okay.
That's why we have this training.
Yep. Okay, just wanted to point that out. So I'm going to skip through that. We're going to mark this as complete, pretending that I entered all that. Save and exit. And then it's going to tell me that, tell me that I have a bunch of missing information. Hopefully you won't see this much. But if you do, please double check that you entered everything correctly. And click ignore this record. And we're going to go into the lab. They did have some labs collected. It's paper to REDCap. And they were collected on the date of the visit, I believe. Yeah, they're collected on the date of the visit. enter that here. Okay. And then it takes a while to enter them out. Oh, just click to again. The hematology labs are collected on the date of the visit. We put that here. Okay. None of the hematology labs were collected on a day from a different day than the others. So we're going to click no. Our hemoglobin. Okay, and I did my best to estimate these values for you, so they might not be super normal. Just, kind of gloss over that. Okay, so this is normal. Total white blood count, white blood cell count was 7.8. Normal, and so on. The thing with this form is if something wasn't collected, click not done. I know I have more information than this in there, but I'm going to skip over since we're running out of time. Again, not done. The first not done on each form or each section collapses the entire section. So if no tests in that category were run, you can click that and it'll collapse everything. But if some of the tests were run, you can click the individual not done here and it will collapse those values as well. Same for chemistry, same for lipids, same for other labs. Okay. So the next form. Okay. Next up is biosamples. They did have some biosamples. Okay. So the date. Okay. Blood draw. The date and the time of the blood draw. So this field is a little different from the regular date and time or date fields. So if you do click the calendar, this will pop up. And then you can select the date that the labs were drawn. So we're going to go back to January 19th. And then the time of these sliders down here. I think these are collected at 11. Let's see. Oh, I didn't include a time. So we're going to say that they're collected at 11 o'clock. Done. Yes, they fasted. They fasted for 12 hours. Okay, so the number of red top tubes that were drawn, 1. Number of lavender purple, 3. And the number of the lavender purple for whole blood was 1. Okay. And they did not have any urine collected, so we're going to click that. And the samples were not processed on a date different than the date of collection. If they were, these date fields would pop up for you to enter the date that they were processed. Like if you left samples with a nurse to have them drawn overnight or something from a patient, for instance. So click no. And then here you're going to enter all of the times. I'm going to skip those. So we're kind of running out of time here. And it's same for PBMC, same for stool. Again, it's pretty straightforward. So I'm just going to cancel this entry. So I'll get that hit error. Okay. And since this person was enrolled while in hospital, they will have a discharge from enrollment hospitalization form. So we'll click that. They do have this form, so we'll click that. Is papered REDCap. Their date of discharge is on the date of the hospitalization form, which I believe is the 24th. Yes. 1/24/2019. Okay. And these fields right here ask for discharge labs, essentially. Please free to indicate all of that. I'm going to skip over those to get down to the questions that are a little less familiar. So you do need to indicate the diagnosis of bacterial infection if they did have one, and indicate which of these they had. If they didn't have any, click none. If they had a feeding tube, you need to indicate that here. And then you need to indicate where they were released to, their disposition, so this person was released to home. And then they did meet with an alcohol counselor during their stay. So yeah, those are the only kind of new questions in this form, in addition to the other labs here that have done it. Just trying to click cancel. I don't want to save that. So that is the baseline. Does anybody have any questions? So all the forms that I went over are the forms that we expect you to fill out for a patient at baseline. No questions? If anybody does come up with questions later, I'd be happy to walk you through this again. We really want you to be as familiar with this as possible before you start to enroll, just to, everything on your end goes quickly and you don't, make silly mistakes that can be easily avoided with just a little bit more practice. If anybody doesn't have any questions, I'm gonna show you some of the new, or one of the new features, I guess. So for individuals who are to be followed up with, but they missed the in-person visit for whatever reason, this initial question used to be a series of like 3 or 4 questions. We've since collapsed that into one because there was some confusion over it. So if they do come in and do an in-person visit, we select the first option. That's the one we would hope would happen. But if they do miss their visit, you have the option to call them or to follow up via their medical record. So if you do call them, you click phone call, it'll pop up the phone script. So if you are entering directly into REDCap, you can read it from here. And then it asks those 3 questions. So is the patient currently drinking alcohol? Is the patient still living? And then the MELD score of the patient. And so so for the medical record follow-up form for a missed visit, that will not go in this column right here. This medical record follow-up column is only for information gathered after their week 24 visit. So if they miss a visit during that 24-week period, that information will go on the specific week. Okay. And then if they do miss a visit, you'll fill this out. So phone call, so that's today. No, they're not drinking alcohol, they're trying. Is the patient still living? Yes. Their MELD score was calculated today to be 23. Okay. Complete, save and exit. Okay. And so even if they've missed their visit, you will still have to go into each of these forms separately to say that labs were not collected, just to acknowledge that they weren't collected. You also have to go into biosamples to acknowledge that those were not collected as well. Okay, so that's what a missed visit should look like, and that's what an in-person visit should look like. Does anybody have any questions about that? No? All right, any questions about the screening database or this one? I know I didn't really show you the study protocol deviations database, but it's pretty simple. I guess I could show you really quick. So each site will see their own record. You only have access to edit this one record, so don't try to add a record. You'll just click the plus sign here, and then you'll fill out the appropriate information for the study level protocol deviations, which hopefully will be few and far between. So once we get to that point and you do have questions, we can walk you through that as well. Okay. All right, well, if there aren't any questions, that's all I've got for you. And again, if you have any questions after this, you come up with something, please, call me or email me, and I can set up a Zoom call if it's necessary.
Thank you so much, Jacob. Thank you.
Yeah.
Does anyone have any questions or concerns? I know it's a lot.
Yeah. And I'm still going to make the specific data entry videos for each form and kind of go more thoroughly over them and a little bit slower.
That's great.
So you'll look forward to those.
Thank you so much. So I think we'll end the call. Sorry, go ahead. I heard someone. No? Okay. So we can go ahead and end the call. Thank you, everyone. Again, if you have questions about REDCap or anything else, please contact us. And hopefully I'll know about the observational protocol soon, and you'll receive an email from me. So I hope you have the good rest of your week and weekend. And oh, happy Valentine's Day. Forgot about that. So, all right.
Happy Valentine's Day. Bye.
Bye.
Bye. Thank you.